Hi, if you or your sister or your friend or any female that you know in your life has been suffering from heavy periods, severe cramping during menses, the point of missing work, and having just a poor quality of life during periods, they could be suffering from fibroids, and this video is for you. So tune in for the next few minutes. I'm going to talk about fibroids, what they are, and what we can do about them. So what are fibroids? Fibroids are growths or tumors are embedded in your uterus. The uterus is your womb that is used for menses, and during pregnancy it grows. Although it's as small as your fist, during pregnancy it can grow and be as big enough to accommodate a baby. So fibroids grow in this uterus or the womb. They can be located in various parts of the womb. They can be deep inside inner surface where the menstrual blood collects and is shed from. They can be embedded deep in the muscle tissue of the womb. They can be on the outside surface of the womb. They can even just be attached by a small stalk to the womb. A fibroid is not a cancer. Fibroids are not cancers. Actually, less than 1 in 1,000 fibroids will ever convert to cancer. This is very rare. Most of them are benign. The sizes of these fibroids can vary. They can be as big as weighing more than 10 kgs in 1 month, or they can be as tiny as a fingertip. The location where the fibroids are located matters as well. Remember, a womb is like this. So if this is where the menstrual blood is, they can be inside. They can be like deep in the muscle tissue. They can be on the surface. They can even be attached by a stalk to the womb. The location matters because different locations of the fibroids can present with different symptoms. You can have one, you can have several, you can have as many as more than 20 in one person. So who is at risk? Generally, African women are more at risk. We get fibroids up to 3 times more than other women groups. Older women tend to get them more than the younger women. Having a baby is protective, but this doesn't mean that you should change your plans, because the plan for your life matters more. Fibroids also tend to run in families. Those who have history of a sister or a mother who's had fibroids are also at higher risk of having fibroids. Even those that have had fibroids before you've had them removed, you run a higher risk of these fibroids recurring. Seeing periods earlier, maybe about 10 years or younger, it puts you at increased risk compared to those who start periods later in life. Being overweight, poor nutrition, lack of vitamin D, nutrition that is deficient in vegetables, fruits, and may put you at increased risk of fibroids. Smoking, alcohol. But for those that may not fall into those categories, what can you look out for? A period that is heavy, soaking a lot of pads in a day, and to a point of getting anemic, feeling weak, having to miss work because of a period, may be a clue that you are having these fibroids and they are in a location where they're causing a lot of bleeding. So having periods that last for more than 7 days may be a clue that you may have to get checked to rule out these fibroids. Sometimes you may just be feeling pain or pressure in the lower abdomen. You may be feeling constipated. When they are big, they may be pressing your bladder, problems with passing urine. Pain during sex can be one of the clues. In some women, they may discover that they have fibroids after they've struggled to conceive. You do an evaluation for infertility and you find that they have fibroids. Some patients may suffer from multiple miscarriages because maybe the fibroid is sitting where the baby may need to attach, and this may be a clue. But what do you do if you suspect that you have fibroids? First step, you need to see a doctor. See your gynecologist so that they can evaluate you, discuss the findings with them, and chart the way forward if they find that you have fibroids, depending on how they are affecting you and where they are sitting in your body. So most likely, if you see a gynecologist, they're going to order a scan which will confirm that indeed you have these fibroids. Now, what happens when this confirmation is done? There are a number of things that may be considered in the treatment. Your age matters. It matters whether you've had kids or not. Your symptoms as well matters. Depending on your age, your family status, your symptoms, there are a number of options that you can go for. Sometimes you can be asked to just watch and wait if they are not giving you any problems, and You may have periodic checkup with your doctor. Sometimes the doctor may give you medication to manage different symptoms, to manage the bleeding, to manage anemia. You may receive medication to temporarily maybe stop the hormones which contribute to the growth of these fibroids, which may help shrink them, maybe in preparation for surgery, or maybe just to get some relief. So different medications may be given for different purposes to treat the symptoms of these fibroids. Sometimes your doctor may suggest that you have a myomectomy, which is just surgery to remove these fibroids. Different settings vary. Some settings may remove these fibroids via open surgery, which is most common. Sometimes you can have a closed surgery or called laparoscopy. This is an option that is that can be explored. If your family is complete or the fibroids are giving you problems, you are having severe symptoms, you may consider having a hysterectomy, which is a surgery to remove your uterus altogether, which will give you complete relief from this bleeding or whatever symptom the fibroids might be giving you. So as you can see, there are many options that you can choose from. Discuss with your doctor, which should be tailored to your symptoms, tailored to how these fibroids are affecting you, what plans you have for your family. Ultimately, the choice is yours because this is your body. So don't let anyone pressure you into removing your womb if you're not ready. So what can women do to prevent fibroids? To be honest, I don't think you can 100% prevent fibroids. Yes, there are some risk factors that have been identified that I alluded to earlier. For example, controlling your weight, because high BMI is associated with higher risk. You can't control when you start your menses. Sometimes you have no control when you want to have children. Maybe you're still waiting for a partner to come along. But you can do little things like watching your weight, being active, exercising more, watching your diet, making sure you screen yourself for vitamin deficiency, check if you have vitamin D deficiency, eat more fruits and vegetables, and generally be active and move your body. It may also help to reduce excessive stress, limit alcohol intake, smoking, and generally just managing your risk of non-communicable diseases like blood pressure control, make sure it's optimal and all that. Otherwise, there's nothing that you can do 100% that can prevent fibroids. Some women, a lot of women have fibroids, but they tick all the boxes for the prevention of the risk factors that they don't have them and they have fibroids. What you can do is when you have them, discuss with your doctor, see the options, and chart the best way forward to manage them. Let me debunk some myths before I end this video. Myth number 1, no, you can flush out fibroids with some herbs. No, you cannot. No amount of douching or whatever you insert or whatever you put on your tummy can flush out fibroids, because don't spend your money on those expensive herbs that you can insert that can flush out fibroids. That is a myth. Myth number 2, if you have fibroids, you can't have babies. No, that's a myth. If I tell you, I show you the women that have had fibroids, they had them managed, or they even carried with the fibroids and they had babies, plenty of them. Yes, some women can struggle with miscarriages or struggling to conceive depending on the location of the fibroids, but generally they do not affect your ability to have a baby. You need to just discuss with your doctor and see to it that they do not affect your fertility. Because number 3 myth, only older women get fibroids. Yes, I said advanced age is a risk factor, but I've seen younger women get fibroids. So what can you take away from this? Fibroids are very common. You should be able to identify the symptoms. If you are at high risk, go and get checked. Get into a routine of tracking your periods. How regular are they? How long do they take? If something feels off, book a visit with your doctor. So if this video helped you, please drop a comment. If you've had fibroids and would like to share your story, you can drop it in the comments. Share this video with someone who you know that may be suffering from fibroids. If you have a question, drop it in the comments. I'll try to answer it whenever I get some time. Thank you for watching. Bye bye.